So based on this, WHO experts can get their own conclusion. But why do they only rely on the evidence CCP government gives them? That's also another question people should ask. What we have to say is WHO behavior in this COVID-19 pandemic include lies and collaborate with CCP government, and also later misleading information like they say it's not pandemic, no point to keep China isolated, travel ban, right? And also no point to wear masks, and no point to take the hydroxychloroquine, and all these things. WHO have done more than I thought in this crisis. Why do they do that? Why do they help CCP government? It's back to that question. Only they can answer the motive.
Very, very interesting. So wait, so you would tell me your perspective on hydroxychloroquine.
Okay, so first, this is not a magic drug. There is no magic drug in the world. But we have to think about whether use this drug or not based on the reality. So practically, as a doctor, if you want to suggest your patients to use something, you have to consider whether it's safe and whether you have alternative choice. And if there is some side effect compared to the good effect, which one is better? So hydroxychloroquine actually is a long-term use drug for over 60 years, initially to be anti-malaria as both prevention and also treatment. And for the long-term study, it's already shown that it's safe for even pregnant lady and kid for long-term applications. Of course, you need to do some half-year check for the retina, but that is not a big deal compared to many other drugs. And also, hydroxychloroquine can be used to anti-SARS. This is even Dr. Fauci show. He has done some research about that back to 2005, I remember. And another thing is, if you focus on the mechanism, SARS-CoV-2 and SARS, basically SARS-CoV-2 is enhanced version of SARS. Their core mechanism to target people is a cytokine storm. I have to mention you, this is discovered by Professor Malik Peiris.
Oh.
Yeah, the first time. And this one means you have the overreaction of your immunity in your body. So your immune system become messed up, start to attack as a good side or bad side. And this one can overcome it. So this drug has been used in autoimmune disease for long term. So based on the three facts I have confirmed, verified, I think at this moment, phase 2 the high mutant virus as SARS-CoV-2, and when we don't have the very effective vaccine, it takes time to do the study. So people has to get a good prevention for this high contagious virus. Then this drug can be applied to help you to get prevention and also help you to get treatment when you have this problem. Of course, we expect for the universal vaccine, the efficient vaccine, or even better drug to overcome this. But at this moment, also, you can compare the doctor's clinical data. You will see the doctor's data who support the hydroxychloroquine, the quality is much better than those against the hydroxychloroquine ones. You will see the result by yourself.
I want to talk a little bit about the statistics coming out of China and get your opinion, because in the US, you have a lot of media will take the official statistics on COVID-19 or CCP virus, as we call it, at the Epoch Times and some others we know. They will report those statistics as if they were fact. So, we have all these countries. China actually hasn't had such a big problem with coronavirus, according to the official statistics. The US is way ahead, both in deaths and cases and everything else. What's your opinion on this?
You mean the statistics of the death toll and also the confirmed case from China?
Correct.
Okay, what I can tell you is even maybe the Chinese government doesn't know how many people get infected and also dead, because there are many methods I have been heard and I know confirmed from China during COVID-19. So as I mentioned, they can postpone the diagnosis, and also they can just refuse to give you enough test kit to do the final diagnosis. And also, so I think maybe U.S. people doesn't know it very well, that also in U.S. and other countries, you can use the diagnostic method to at least 90 to 95% accuracy. But back to mainland China, although my lab already, the first time, at the very early time, developed the quick diagnostic kit and recommended by WHO to many countries. But in mainland China, they don't apply that. They just use their own one, and their own ones in many versions only have 20 to 30% accuracy, which doesn't mean 30% accuracy, you did 3 times test, you can get a good result. No, that means at least you have to do like 9 times or even 11 times, you get a real result. But remember, back to China, 2 times is the result confirmed. So you can imagine how many cases are ignored in such situation. And one more thing is maybe can make you understand it better. We even didn't have deaf people in Tiananmen event back to 1989, according to our government.
Oh, I see. So, well, the big question is there, in your opinion, a political will to underreport, right? That's the allegation. That's what the data that we've seen suggests, like the grossly underreporting. But that's why I want to get your perspective on that.
Based on the diagnostic cases, what I know is definitely the real death rate is higher, much higher than what they reported, because as what we have studied in even influenza study, I mean, the Chinese government used another way to judge the death cases. It's not like in US and other country, you get infected, you go to hospital, and then somehow you passed away due to even complications or other things induced, other problems induced by this infection, then you are counted as a death case of COVID-19. Now, in China, it's like this. What I know, they even can give these people some ventilation and other life support until they get twice test for negative of your result in mouse. I mean, using the swab sample. And then after that, they can remove the ventilation and say, oh, he died, but he's not died of COVID-19.
Do doctors in China know that there's been a kind of cover-up and the reporting is inconclusive around the coronavirus?
Not only doctors, even the common people know, especially back to the early beginning. They know that they're unfair, especially before I reveal it through this media, the YouTube media, and our government has to change their statement to human transmission exists and claim there are more cases happen outside Wuhan. Before that, our government leaves those patients without result in the common ward in hospital, and doctors, patients' relatives has no any protection, and they are all unfair, and also government don't allow them to talk about it. And also later, when there are other measurements, like you cannot publish paper without censorship, the articles, and you cannot do some kind of treatment, you have to follow up the guidance, like using some kind of Chinese medicine they recommended. So these are all the things they know, but I have to say that not because they don't want to tell truth. I mean, there are some doctors and group of people, professional people, they really want to tell it, but consider the situation back to China, like you see the Hong Kong, the state security law, this kind of pressure, they have no way to tell it. And if they tell it, they have to face to huge loss in their life. You cannot expect everyone try to do such things that take a lot of courage. So they know it. And many people, more people as you thought, know it, but they cannot even talk it in public.
Well, okay, so tell me, why did you decide to go public with this, knowing the risk?
Okay, because I have been signed twice for this investigation. And back to mid-January, when I did the second investigation, I realized the real situation is worse than I thought, and no action from WHO to CCP government to overcome this. So at that time, 17 January, when I see these things, I decide to tell it through my own way. I had to find a way to tell the world, I mean, at least to let our government understand their huge pressure from outside. You have to do some action. I mean, not suspend the research from overseas expert. Instead, you should let people go to Wuhan to know what happened, because that is a Chinese New Year time and huge millions of people do the transportation through Wuhan. That is big center. So it will make the, outbreak soon. But I know I cannot rely on my supervisor and government. So I think I have to tell it through the only media I trust from Mr. Lu De. And at that time, I know I will face to the life threatened. And as the other Hong Kong protesters or other people who try to tell truth in China, I can be disappeared at any time without even any evidence. But I also cannot face to the fact in the future when I see the outbreak come out, people suffer from this and things still cover up, but I didn't tell the truth at that time. I cannot face to that. I won't forgive myself. And also I realize if at that time I don't tell the truth, that means I lose my capacity to tell the truth in my life. So that's why I decided to deliver the message to Mr. Lu. At least before I get disappeared, I want someone else can deliver the message out.
And that's incredible and you're very, very courageous.
Thank you.
Briefly, tell me, what happened after this and how it is that you ended up coming to the United States.
Oh, after this, several hours after Lu De's show played on 19 January this year, our government quickly got response because they know someone released the real information. So after 4 hours, the confirmed cases number from 60 jumped to 198 triple times. And also the next day they confirmed that there are other cases happen in Guangzhou, in Shanghai, outside of Wuhan. And then they admit human-to-human transmission exists. Also, Chairman Xi issued the statement, the first statement in 2020 to update the level of SARS-CoV-2 into the similar infectious disease as SARS. And later, 3 days later, Wuhan got locked down. After that, because there are more lies coming out of my expectation, and they didn't do real efficient measurement to control this outbreak, so I become very angry and also disappointed to my government. I already have been to this investigation, so I think I know more than other people. I realized it at the time. I keep working with Mr. Lu De and deliver my message through his platform to tell people, for example, like what happened in the hospital, how the government censored the study about COVID-19, like this. And my government understands that they definitely going back to trace the source for Mr. Lu De. So back in the middle of April, Mr. Lu De told me that I'm in danger. And also at that time, I realized that English-speaking country and Chinese-speaking country are totally isolated. Our message was efficiently delivered to our audience in Chinese. But overseas, when people face to this pandemic, they are misled by WHO and the Chinese government. They don't understand what happened. And I realized I may be the only one who can tell this truth to the world. But I really cannot tell it in Hong Kong. Once I stand out, I will get disappeared. You know nothing. So at that time, Mr. Lu De and the other organization who help the people when they get persecution from China government, they helped me to escape from Hong Kong. And I took the flight just after several hours when I left. The Hong Kong policeman immediately know it. The University of Hong Kong, from the Vice Chancellor Prof. Zhang Xiang, they organized alumni and student staff to search me, to get all my information. And some people from my friend group work with the Hong Kong government or the policemen. They told all my friends, even middle school friends back to China, that I have no privacy. They have to tell the policeman all the details they know about me, especially related to COVID-19 things. Because I'm involved into the criminal case, and they have to take responsibility for hiding anything related to me. And back to my parents, just the same day, when I'm still on the flight, the Hong Kong government informed the National Ministry of State Security in Beijing, and then they sent people to Qingdao, my hometown, to my home and treat my family. My parents were I have to say, brainwashed, and they obedient, collaborate with them, thought I'm lying, and I did something harm the security of my beloved homeland. And also, from the middle of May, even before I come to the public, our government started to spread a lot of rumors to attack me. They gave the fake Facebook account using my profile, and they spread the rumors on Twitter, use cyber military, and also on Reddit, on YouTube, and they ruin my reputation and try to describe me as someone who is poor and do nothing, incapable, and they want to get money and green card from US. And also, although I have a Nature paper as co-first author, they just describe me as a hamster keeper in Hong Kong. Like this. So they try their best to ruin me and ruin my credibility and